This is go live. Go live. Okay. So we are live. Okay. All right, cool.
Okay.
Hello, everybody. Hey. So I always say I'm excited to be here, but for real, I'm really excited about today's live. Not only do I have a friend, I also have an expert. I also have a family physician, lifestyle physician, obesity physician. She's into wellness space. Like I am delighted to be on here having this conversation. If you are joining us live, hashtag live. If you're joining replay, hashtag replay. If you know a friend that should be here, please let them join. It is possible to beat blood pressure issues and diabetes using lifestyle hacks. And that's what we're going to talk about today. Dr. Ashaye, I am honored, delighted, and excited to have you on here. Hi, sis. How are you?
I'm good. Thank you for having me. I'm very excited to be here too.
You will give us some love. She's a fine girl. She's awesome. She's taking her evening to come and spend time with us. So please show her some love in the comments. I appreciate you. But today we're talking about easy tips to bust high blood pressure and blood sugars. And I'm sure Dr. Ashaye can also relate. I've had people get off blood pressure medicine and diabetes medicines using lifestyle. We actually have a dance that goes with it. So I'm excited to have this conversation. And please, have your notes ready, have questions. We'll take questions live. But Doc, could you introduce yourself? I know they know that you're my friend. Who are you and why you do what you do, Doc, real quick before we go in?
Sure. I'm Adelola Ashaye. I'm a family medicine and lifestyle medicine physician and CEO of In Touch Primary Care in Sugar Land, Texas. I love what I do as a primary care physician. My mission is to help people prevent serious health conditions, to optimize their health so that they can live fully and enjoy doing what they love.
Okay, why did you delve into lifestyle? Why was that important to you?
Lifestyle is so important, it's foundational. And I think when I started doing family medicine, as you know, I did it for a few years before I decided to learn more about lifestyle medicine. I started to see that we were adding medications a lot of times, chronic conditions were not improving. And I wanted to find a better solution, a way to help people get better, truly get better, not just, add medications. And with lifestyle medicine, just learning foundational things, using foundational lifestyle things has made a huge difference for a lot of our patients. Because if the foundation is not, if you're not doing the nutrition, the sleep, the physical activity, stress reduction, all of that, when you just put medications or even supplements on top of all that, it doesn't work quite as well. So lifestyle medicine is so key in terms of getting people to become healthier and, really truly enjoy their lives.
So you're saying it's possible to use lifestyle to control high blood pressure and diabetes. I want to make sure that's what we're saying.
Yes, that's what we're saying.
All right, awesome. So real quick, I know we're talking about two different diagnoses here, so we'll try to kind of see how both of them interconnect. But what are the real causes of high blood pressure and high sugar, generally speaking?
Yeah, so generally speaking, we see these things come together because the root cause is the same. So I think when people realize that the inflammation and insulin resistance drives high blood pressure and high blood sugar, and when you address it from the root cause, both get better. And that's why a lot of people end up with having those two conditions at the same time. And oftentimes it comes with high cholesterol, which is a cousin that tends to come along with the other thing. So yeah, the real cause is inflammation in the body, insulin resistance, and together that's driving inflammatory processes throughout the body.
Okay, so inflammation. What causes inflammation? Yeah.
So inflammation is a combination of things. I mean, in terms of there's a genetic component, right, which to some extent it's just, some people have a predisposition, right, based on their genetics. And then, the good news is there is a lifestyle part on the environment as well, which is processed foods, which is a big part of what causes inflammation. So when we're able to lower processed food intake, and really stick to more whole foods and more real food, we're able to lower inflammation in the body. So that's one of the things that cause inflammation is processed foods, and I think that's probably one of the biggest things. There are other things, in terms of um, physical activity can help, to improve, the way the cells work so that they can deal with inflammation better. Stress reduction can also help to reduce how much inflammation is in the body, because when we're stressed, our hormone levels rise, and that can cause inflammation. So it's a combination of things, but a lot of the lifestyle factors are responsible for inflammation.
Okay. All right. So you talked about processed foods. Doc, we're in Texas. You're in Sugar Land. You're in the Houston area. I'm in Dallas. We're in Texas. So can you define what processed food is? And for those of you watching, please bring your questions. So we talked about processed foods as a cause of both high blood pressure and high cholesterol and diabetes, which are the three things that typically lead to heart attacks and stroke and heart disease and all that bad stuff. But what is processed food?
So when I think about food, and what I try to explain to my patients and my family, and is food is something where, if you think about, you can go in, dig it up from the ground, and you can imagine what it will look like. Like, you go in the ground, you dig up a potato, and you can see it. And if you boil a potato, it still looks like a potato.
So
That's
French fries are good because it's
so
from
French
potato.
so French fries are then processed. So
Okay.
in order to get from that potato, so in order to get to French fries, you have to process that potato quite a bit to get to the French fries. That is processed food, right? Chips, for instance. I mean, you have to think about, how did this, chip come about, right? You have to process it to some extent to get it, get
Wait,
it.
wait, Dr. Oshai, wait. What of the kettle ones? They're supposed to be healthier. The kettle.
Yeah, they're processed. Anything that you have to put through a process to get it to look like what it is. I mean, some foods you're going to have to process to eat. Like, you will still have to boil a potato or bake a potato or something. But many foods you can eat raw, like fruits and vegetables. And that's why those are a lot better for us, because they are whole foods that are very minimally processed or not processed at all. And we get the best nutrients from them.
Okay. So for someone who's watching who's like, wow, it sounds like you're saying my food has to be boring, and rather bland and not exciting to eat. And so that's where the conundrum is. High cholesterol, low fat, diabetes, low sugar, um, blood pressure, low salt. Are there tricks to the trade? Because food is a big part of, like, I feel like food is like a hug to your mouth.
Right.
You understand? So are there hacks, like what are ways we can reduce processed foods without feeling like we're depriving ourselves of good stuff?
Yeah, and that's really important. I mean, there's definitely going to need to be a mindset shift over time about how we think about what is good versus, what is actually good for us. But there are ways to make it easier on us. One of the things I talk to people about, because that is a real concern. You can't eat sugar, you can't eat salt, you can't eat fat. What can I eat, right? I tell them, think about it as your add-in. When you start off, just try to add as many fruits and vegetables to your diet. Try to add as many whole foods to your diet. And when you fill up with adding the good stuff, over time, you start to reduce, the stuff that you should not eat as much of. So that's one hack. There are many different ones, snacking, finding things that maybe crunch. Carrots are popular, nuts are popular, replacing things and making it interesting. And there are many recipes right now online that you can actually find, and food can taste really good and be healthy. So it's just trying to find ways to substitute processed foods with whole foods.
Okay. So we're going to talk about a few hiccups. And I like how you said add fruits and vegetables essentially to every meal. The first one is, well, fruits have high sugar. They're high in sugar. When I eat a like strawberries, they're sweet. So I'm not going to do that because fruits are bad for diet. What are your thoughts on that?
So it depends on how you're processing the food. So I, caution people about juicing, for instance,
Okay.
because when you're taking a whole bunch of fruits that high in sugar and juice it, all you get is the sugar out of it. Yes, you're going to get in trouble that way. But when you are eating a fruit where it takes a long time, you have to chew it and your body has to digest it, you get full a lot faster when you're eating, you're getting the fiber. That is fine for many people. Yeah, there are still some people that have diabetes that may have to, be careful in the ratio and choose fruits that are not as sweet, especially initially when they're doing this
Mm, mm.
transition. But it is possible to be on a whole food diet that is mostly, vegetables, fruits, that are healthy fruits, and making sure you're not overloading on too many sweet fruits because you can do that.
Yeah, so, and she mentioned that there are some foods that don't raise your sugar that high. So you can have that conversation with your doctor, but staying away from fruits is not the answer. So
Right.
the fruits that you pick. I have a good suggestion here, and please drop it in the comments. Mr. Sean, thank you for joining. She said cucumbers with crushed red peppers. I like that because pepper
Yep.
is a very good flavor enhancer. So what are things like? So for those of you who are watching, if you give us things that you do that help, for me, it's eating salad. For those of you who may be from Nigeria, I'm putting suya in it, like
Mhm.
leftover chicken, leftover spicy meat with no dressing, and I use that as a way to get me eating fruits and vegetables. So I have someone who's watching who's like, yeah, but fruits go bad quickly. So I've had a few patients tell me, yeah,
Mhm.
they go bad. No one eats them. It's just me. It's in the fridge. Any hacks to get it to make it easier? And how do we normalize the fact that you got to buy fruits every week? Doc.
Yeah, so a couple of things that I do, for instance, I've noticed even with the kids, like when you cut up fruit, it goes fast, much faster. So cutting up the fruit and leaving it out for, there where people can see and eat it, there's just something about that that makes people more likely, if you have a fruit bowl, put it in the freezer. You can freeze fruits before they spoil and then, use them later. So I know the kids like grapes, for instance, will freeze them and they would just eat them frozen and they taste pretty decent. So you can do things like that, but yeah, you're going to need to buy fruits, to keep them fresh from time to time, like bananas. Yeah, I guess you could freeze them and make some kind of banana ice cream with just the banana, and that will be fine too. So there are ways you can kind of, keep them a little longer, but for the most part, it's nice if you can eat them fresh and just cut them up.
And I like how the kids like frozen grapes in the summer. That's a very good treat. And sometimes I have them make smoothies, so they'll blend up all the fruits and veggies and then put it in a popsicle stick thing and get the kids involved in it too. I have a comment saying I buy mine already sliced. Okay, you could do that
Do
too.
that too.
You
Right.
can buy, you can buy sliced fruits and vegetables, and it's a very good conversation starter. Have it cut up. You have a fruit basket in your kitchen aisle. You put it right there. People are grabbing and going. But doc, any more tips for the parent who's like, yeah, it's frustrating. I have it cut up. They're picky. They're like, the broccoli looks like a tree. Like, what are other hacks for to make it conducive for including the men in the conversation?
Yeah. So sometimes you have to put it in different types of foods that they like. So I have one of those that, thinks anything green is a plant and shouldn't be eaten. So you, so you have to be creative. So you sometimes you would have to, and try different things, roasting and trying a variety. So I think that's the other thing. Like sometimes you just have to go out of the box and look at different options and not just have the same option all the time. So broccoli is popular, kale, spinach, and things like that. But sometimes you need to look at squash and see, is there a way I can make that in a different way that would be
Mm.
interesting, would attract the kids and maybe they'll eat it, or sweet potato or something. So just looking at other fruits that maybe may not be in your comfort zone. Recipes, I'm big on just looking up recipes and trying different things, and that can be helpful too.
One of the things that I found to be helpful too is putting the same spices I used to cook our regular foods in the veggie. So the smell, they like it's familiar, and so they will eat it. Um, so that has been a trick. And then saying things like, "Oh, I love you. Here's a banana, huh? Yeah, I love you. I'm giving you something good," as opposed to "Here's good job. Here's candy." So we send the wrong message. So we have to correct that so our kids are not confused. All right. So we talked, and these things we talked about help with both blood pressure and with diabetes. But let's talk salt, Doc.
Mhm.
What role does salt have to play in either? And for those who are watching, it's like, are you saying that I need to give up salt?
Right. So blood pressure, when we talk about salt, we often think about, blood pressure and how high salt diet can affect our blood pressure, which it can. The issue with salt is not everything that doesn't, there are many things that don't necessarily taste salty that have salt. And so salt hides. And so we're not talking about just salt when it's salty, we're talking about the sodium content. And so with salt, it's so important that we're looking at labels and not relying on just how things taste, because a lot of things could have high sodium content and not necessarily taste salty based on how it's processed. Um, but there's some people that are very sensitive to salt. What I have seen, and I don't know, Dr. Olabintan, you can see about your practice, I've seen that not some people are very sensitive to salt and some people not so much, right? So I think part of that is understanding where you lie, and that means that you are checking your blood pressure because otherwise you wouldn't know. So some people can tell because they get a headache or they get lightheaded or whatever. That's not good if they're getting to that point. But some people don't realize that they're very salt sensitive, and maybe they get their legs get swollen after they eat something salty, or they have palpitations even in some cases. So just being aware that salt does impact blood pressure is really important, but not looking at just how it tastes, reading labels to determine if you are getting too much salt.
Okay, Doc. Someone made a comment. She put salt on her lemon. Mr. Sean, I'm gonna talk to you when I see you more. Okay, about that. So okay, but you said salt hides. Can you give an example of where salt hides so people have a general idea of how to find them out? And then I have a very good question here in the comments. Miss Doris, please hang on. Okay, go ahead.
Yeah, sure. Yeah, bread, for instance. So you can have some breads that have a high sodium content, and for many people, if you mention bread, they don't think about bread as something salty, and it can hide there. So one way to do it is, if you're going to decide on what type of bread you're going to buy, if you want to eat, some bread, you want to pick one that has a lower sodium content. So you're looking at that when you're trying to decide. So that's an example.
Okay, awesome. And then the obvious ones: your bacon, your sausage. I mean, your cured meats. Like, yeah,
You can
no.
taste that one.
And then pickles. Pickles get me really annoyed sometimes because we're like, "Oh, it's a veggie. You said eat veggies." I'm like, "That's not what I meant." Um, but for someone who's watching, who's like, I mean, no offense, I'm Nigerian. I'm cooking rice. I gotta put salt in my rice.
Mhm.
So how do we make it taste still edible but not as much salt?
Yeah, so herbs and spices can be very helpful in cooking, and using natural herbs and spices, onions, garlic, parsley, oregano. There are many, many spices that you can use to add flavor. And there are some brands that are, seasonings that have already, like, Mrs. Dash brand is popular, where they're seasonings without salt. And so more and more we have more options like that, so that you can lower how much salt you're putting in certain foods. But I find I really like using herbs and seasonings because it really make it taste really good. Um, but you don't have to add a lot of salt when you do that.
Yeah, and I find that a little olive oil, and then if you put the salt towards the tail end, you don't if you don't cook it too long, it still retains its saltiness.
Right.
Um, Now I have someone who's asking a very good question here. She says, "How healthy are salad dressings like mayonnaise, ranches, and salad creams? Is it better to eat your salad without these creams?" Very good question.
Yeah, that's a great question, because it's possible to, negate the effect of the salad right? The amount of dressing that you put on it, but not, looking for lighter dressings. Ideally, if you can make your own, that's ideal because then you can control what you put in using an olive oil base. But not everybody, is able to do that. So you can find one that is healthy. But yeah, many of the mayonnaise, the ranches, the salad creams are heavy, and some of them will have saturated fat. Some will have the sodium in there. They're processed, So if you can lower the amount or get a light dressing or make your own dressing or eat it with other things, like fruits can be a great enhancer for salads. Some people even will put a little bit of cottage cheese or beans. Adding beans to your salad can enhance it without having to add a dressing, or tuna. So you can find different ways of putting things in the salad. And you had mentioned suya, that's a new one. Um, to add to the salad, but you can enhance your salad in other ways so that you don't have to use so much oil, because some of these things also have oil base, and depending on the kind of oil that's used, it can, you're introducing, processed foods.
All right. Which this very I'm trying to type and put all this here because I don't want us to lose this. And vinaigrette, yes, usually better. I have to say, I looked at some of the salad dressings. Sometimes they contain like half a table or teaspoon contains almost a third of the amount of fat you should have in one day. For me, it's not worth the calories. So
Right.
I've been dressing free for almost 8 years. I don't eat dressing with my salad because for me, I'd rather eat my calories somewhere else. You don't have to do that, but you got to look at the bottle to see what you're eating because sometimes the salad dressing defeats the purpose of eating the salad. Um, and all right, now let's talk exercise. What role would you say they play in either blood pressure and blood sugar? Because someone's listening and saying, "Well, I feel like if I exercise, I'm stressed, or my blood pressure go up. I don't want to exercise." What are your thoughts, though?
Yeah, I want to say one more thing about nutrition. I would say another way you can maximize nutrition is cutting out a lot of the juices. That's one place that people gain a lot of calories, but by just, sticking to mostly water, lemon water, whatever way you can get the water in, fruit saturated water, that can be really helpful in lowering, sugar, because that's one way people get a lot of sugar with drinks.
What is
Um,
fruit juice, doc? Is fruit juice?
right. The fiber, the fiber is the important part. So when you get just the juice out, you're getting pretty much pure sugar at that point. So just being careful with that. Um, so in exercise plays a big role. What I would say about exercise though is nutrition is first, I want to say, because I see some people using exercise as a crutch in a sense, like, oh, I exercise, so now I can eat whatever I want. Doesn't work that way. Like you, I would rather you ate well because food is medicine than you try to say you're exercising and so you can eat anything, because it doesn't work that way. You need the nutrients in order to be healthy, and then exercise is an add-on. Exercise has so many benefits regardless, right? But still, like, that's the caveat, because I've seen that happen a lot. um,
Oh,
but
sorry, Doctor Lola, I want to hop on that a little bit because I've had people upset when I said that. You cannot exercise away a bad diet.
right.
The amount of effort it takes to burn 300 calories to 500. If you ate 800 calories, it would take almost 8 hours of unending exercise to burn it. People say I think I'm mean when I say that, but I'm not. Like you cannot outrun a bad diet. So it's better. Listen to what Dr. Lola is saying. The food piece is really important, and that's why we're having this conversation. But go ahead, Doc. Sorry.
Right, yeah. So the exercise, when you add that on, it's powerful, right? So cardiovascular exercise is very helpful, and to, get the heart, the blood pumping well, and everything doing what it needs to do. We know that 150 minutes per week is what's recommended for cardiovascular exercise. And then strength training also is very important to build muscle and to help people burn fat, and also improves insulin resistance, lowers blood pressure. So there are many, many advantages of exercise, and it's important to try to incorporate. I would say exercise initially, some people really like it and they go very hard, and then some people just shy away because it feels so hard. Consistency is so key. So for people that shy away, I just start with 10 minutes. Like, it doesn't have to be a huge production. Just do whatever you can do. Try to do consistently. One trick is, if 10 minutes looks hard, try 5. Honestly, I wasn't a huge exercise person when I started, and I had to, I had to just decide that I was going, and I literally started with 5 minutes. Like, all I would do is challenge myself to walk out the door and walk outside for 5 minutes and walk around and come back. But I tried to make sure I did it almost every day, 5 days a week. And then after a while, it became 10. And after a while, it became 20, then you start to enjoy it. But the consistency is so important. And then the people that go really hard, consistency is important too, because what I see with that group is they go really hard for a month and then nothing. And then really, so it's better to just do. You don't. It doesn't have to be that a production. Just do something, but make up your mind to do it consistently.
It doesn't have to be production. I like it. Just pick something. I love how relatable you are. Start with 5 minutes and inch it up, but start. And that's key. All right, doc. Someone mentioned here foods that are good for high blood pressure. Someone said, and thank you, Mr. Jaffrey, for contributing that. Garlic is good for high blood pressure patients. What other foods would you say are good for lowering blood pressure? We talked about the fruits and vegetables in general, but are there any specific ones? If someone says, "Yeah, I'm not a veggie food guy, but if you tell me the ones that are most effective, I'll shoot for those ones." What would you say, doc?
Yeah, so there are studies about this, and yeah, thanks for bringing up garlic. There's also green tea has been associated with lowering blood pressure as well. Anything with potassium, so that's green leafy vegetables, lower blood pressure. Potassium is great, and even the new guidelines actually say supplement with potassium to lower blood pressure now. Um, Let me see, what else would I recommend? There's Zobo. What's
Beets.
the
That's the beets.
what's the
That's it.
hibiscus?
Hibiscus tea.
Yes,
Hibiscus tea.
hibiscus flower. That's also been associated with lower blood pressure.
Wait,
Um,
wait, wait. She's not saying if you have too much sugar, she's not saying go and drink it. So
right, no,
they
exactly.
hibiscus. That's okay.
Not the one with the ton of sugar in it. You
Sugar
can
in
make
it.
it yourself actually. You can buy
Yeah.
the leaves, boil it down, and make it into a tea. So I know they do that in the islands. So yeah. So there are ways to. There's some foods that are associated with lowering blood pressure, just as some foods are associated, like foods with high sodium, associated with higher blood pressure. So, but yeah, the garlic, anti-inflammatory. Foods can also help in general, like turmeric and other anti-inflammatory substances.
Okay. We're wrapping up, but I want to ask one more question. And this I see often: patients who are stressed. Work. There's a lot of stresses right now. Some job uncertainties have people a little overwhelmed. And so, can we talk to stress tips? Um, and from the point of view that it affects your blood pressure, regardless of what causes the high blood pressure, it needs to be addressed. So, any quick stress busting tips for blood pressure, doc?
Yeah. So stress, I tend to start with sleep to try to lower stress, like make sure you prioritize sleep and try to get enough sleep because that will lower stress. That's a very natural way to lower stress. But also finding consistent stress lowering habits that you can build into your daily activity, daily life. So, whether it's meditation, prayer, exercise is a stress reliever, even just listening to music, you just finding something you like that you can do consistently and do it to lower your stress daily. And then on top of that, there are other ways that other strategies to lower your stress in the moment, like deep breathing and that sort of thing. So but it is important to have a daily stress reliever, something that you incorporate into your lifestyle every day as part of your daily routine, in addition to having something that you have pre-decided that when a stressor happens, this is how I'm going to handle it so that you're not, stressed.
Okay, so it's important to manage stress. We got to do it in the stress-inducing environment. We got to master the skill. Doc, this has been good. We got 1 minute. So for someone who's watching, who's like, "Whoo, Doc, this is a whole lot of information. I feel a little overwhelmed." So the person has high blood pressure, has diabetes. What would you say, real quick? 3 quick tips on how do you encourage them to bust both of them at once, and then we'll wrap up. Yes.
Sure. So, baby steps, there's definitely hope. Pick one thing from what we've talked about today, something that may have resonated with you, and, start with it, track it, and see how you do for a month, and then build on that. So, just pick something, make a decision. I'm going to do this one thing today. I'm going to stop drinking juice or just water. I'm going to add a salad to my plate every meal. I'm going to, cut out this food that has a lot of salt, and then track how it's affecting your blood pressure, your blood sugar, or both. And then do that for a month, add on another thing, and just keep going.
I love it. She just gave you a 30-day challenge. Booyah! I love it. I love it. Pick one thing, 30-day challenge, see the results. Doc, can you share real quickly a success story, a patient who you use lifestyle to help so we can encourage viewers on what is possible?
Oh, yes. I actually just saw a patient last week who has used lifestyle. Her main purpose was to lower her weight, but then her blood pressure was high as well. And she's lowered her weight now by 38 pounds. It's been a year and a half with just lifestyle changes. And she has also lowered her blood pressure just with lowering her weight. Nutrition has been big. Physical activity has been added, consistent physical activity is not always a lot, but just consistent. And she's working with the therapist to lower her stress. She's sleep. We worked on sleep quite a bit, and she's improved that with her and her family have improved their sleep. And so she's doing fantastic. I'm always excited to see her. She's doing really good.
I love it.
And her back pain is better, much better now.
You know what I love? The truth is, we're having this conversation to empower you to make lifestyle changes. So you will need to see us less. That's the whole idea. So there's a win-win for you. Doc, thank you so much for doing this. Virtual hugs, virtual hugs. All right. So Doc, where can people find you? For those who are in the Houston area who's like, oh, I need to see this doctor. I need to connect with her. I need to have her come speak to my folks. Doc, where can people find you?
So In Touch Primary Care, that's in Sugar Land, and they can find me on Instagram at In Touch Primary Care, on YouTube at In Touch Primary Care, on Facebook at In Touch Primary Care, LinkedIn, Lola Ashaye. So that's where you can find me.
In Touch, that's one word, right?
Yes, In Touch
Primary Care. All right. So you can look her up in all the spaces. The only exception is in LinkedIn, where she's Dr. Lola Ashaye. All right. Please show her some love. Can you please appreciate her in the comments? She's a good job and she's beautiful. She's beautiful, my beautiful sister. I look forward to seeing you. Sorry. All right. So I put her information at the bottom and her full name. She has a lot of useful content, easy, accessible, and implementable tips to help you live long and well. Thank you all for watching, Dr. Lola. Thank you for stopping by. We're definitely going to have you again. No pressure. So maybe in a few months, 6 months. Can't say no because everyone's watching you.
I'll love to be here. Thank you so much for having me, Dr. Olabintan. You're a great doctor. Your patients are really, really blessed to have you. And thank you for what you do.
Thank you so much for coming on. And those of you who watch, who ask questions, I appreciate you. Please share, like, subscribe, follow me, follow her. And if you or anyone you know is looking for an awesome doctor in the Mansfield, Texas area, I am she. And if you're looking for one in the Sugar Land area, well, I can vouch for her. She's she. All right. Have a good one, everyone. Thank you, everyone. Have a good one. Appreciate you.